It's my great pleasure this morning to introduce Lance Robertson. Lance is the Administrator and Assistant Secretary for Aging in the Administration for Community Living. Prior to being appointed as Secretary of Aging, he served 10 years as Director of Aging Services in Oklahoma and 12 years at Oklahoma State University, where he co-founded the Gerontology Institute. ACL's Hillary Dallin has offered to monitor questions that are posted as Lance speaks, and she'll pose as many questions as time allows to the Assistant Secretary. Lance?
Hi, everyone. Happy Friday. Hey, thank you to the American Bar Association Commission on Aging for having me on, and certainly, as David said, all the sponsors of the 2020 National Aging and Law Conference. And special thanks to you, David, for your dedication and just all the great work you do this wonderful conference, and certainly for your kind introduction, and certainly for all the things you do to advance the rights of older Americans. So it's great to be with all of you, as certainly strong advocates who I know are participating in this conference, and you are the key supporters of elder rights, and I'm so grateful for what you do each and every day. Though this year's conference, of course, may look a little different from years past, it remains an important annual opportunity for the elder rights and legal assistance community to come together and share experiences and knowledge. And I can see from the agenda how valuable all of the learning yesterday and today will be for all of you and for us. And what a pleasure it is to be part of this opening lightning round plenary. I know I'm going to be followed by 13 speakers who are touching on 13 important topics, everything from scams to tax issues to telehealth and cameras in long-term care settings. As always, this conference has provided an opportunity for everyone, including my ACL team, to learn about the latest and most compelling legal issues affecting older Americans and to build this community's capacity to more effectively support the rights of older Americans. I know most of you are actively engaged in learning about new ways for dealing with the same legal issues that persist and dealing with new ones in the context of COVID-19. Now, I'm not going to sugarcoat things. We know this has been a hard year, particularly for older Americans and those who support them. Hopefully you'll recall, though, that the year did start off with a major success in March when we got the reauthorization of the Older Americans Act across the finish line. The 2020 reauthorization, as all of you know, takes us through the year 2024. And the reauthorization continues, of course, to recognize the importance of legal assistance in supporting rights for all older Americans and promoting elder justice. Now, back in January, none of us could have predicted our current world of masks, virtual court appearances, nursing home lockdowns, and online conferences. Soon after the pandemic began, it was not hard to see the impact that it was going to have on many of ACL's programs, and we knew the impact would be felt by legal assistance providers and your clients. And I know you've always been a critical force for elder rights. But now, as we are living through extraordinary times, your legal advocacy work with older Americans is more needed than ever. I salute you for the many critical ways you've engaged with older Americans to support elder rights and elder justice during this time. Some examples. You have been preventing homelessness by defending against evictions and utility shutoffs. You've spread the word about steps older adults can take to reduce the risk of falling victim to new and existing scams and fraud. Encouraged by you, your clients have been empowered to report the acts of scammers and predators who perpetrate and financially exploit older adults. Your efforts to empower clients have helped our partners at the Department of Justice and the Federal Trade Commission and even the Consumer Financial Protection Bureau as they go after bad actors. You've used all the legal tools at your disposal to enable your clients to recoup what they've lost as a result of abuse, neglect, or exploitation. You've collaborated with long-term care ombudsmen to support residents' rights, including the right to not be evicted and the right to return following a hospitalization. And finally, you've worked and partnered with great dedication to address loneliness and other quality of life and care issues for quarantined long-term care facility residents, as well as those who must isolate or quarantine in their own homes to reduce risk associated with the pandemic. And then finally, by counseling clients on their rights regarding their economic impact payments, you've helped them obtain the funds that were rightfully theirs. With your help, clients learned about their right to not be obligated to turn their stimulus checks over to residential facilities. And when other parties did not understand or accept the applicable rules, you advocated on behalf of your clients so that they could receive the economic impact payments that they were due. You also help clients understand their rights about these payments, that they do not affect eligibility for Medicaid or other entitlement benefits for at least the next year after receipt because you know the eligibility rules. So that list of 8 items I just ran through quickly, and I know it's by no means comprehensive, scratches the surface of the critical legal assistance advocacy that you've engaged in over the past 8 months. And this list, of course, would be impressive in normal times, but in these challenging times, it's nothing short of remarkable. And while it hasn't been easy, you have demonstrated an awe-inspiring degree of creativity and ingenuity as you have found ways to continue your advocacy. Back in March and April, you mobilized quickly to reconstitute full advocacy services from home offices, even as you probably schooled kids or took care of older loved ones. You learned to employ new tools, download new apps, develop new strategies to continue your advocacy, including video conferencing, digital document signing, and much more. You used a mix of tactics to connect your older clients to the full range of needed legal services, from helplines and phone apps to implementing new community lawyering strategies. You've adapted to new methods of courtroom advocacy, such as phone, video, and modified in-person appearances, while grappling with the pragmatic and ethical issues raised by these new ways of doing business. You've renewed and deepened partnerships throughout the Aging Network and with your many state and community-based partners. These partnerships have allowed for robust issue spotting and opportunities to educate your communities about legal problems that older adults are facing during this pandemic. And all the while, you've listened to and advocated for those who have suffered and lost loved ones as a result of COVID-19. I know your days have been long, and I'm sure there have been a lot of tears that have been shed. And all I can say is thank you. Thank you on behalf of ACL, HHS, and our nation from the bottom of my heart. Let's talk just a quick second about the ACL COVID response. So while you were rising to the challenge, ACL was also hitting the ground running, and you saw that firsthand. Starting in early March, soon after the onset of the pandemic, our Office of Elder Justice and APS and our Office of Long-Term Care Ombudsman Programs worked with our resource centers. Those, of course, as you know, include the National Center on Law and Elder Rights, the National Ombudsman Resource Center as well, and partners inside and outside of government to develop FAQs, tip sheets, and other resources that can help everyone navigate a rapidly changing situation. We held webinars and offered technical assistance consultations to try to get the most up-to-date information into your hands. We highlighted promising practices emerging from your work on our website at acl.gov/COVID-19, and we sent out updates via email. We use social media to alert our networks and older Americans to resources they can access and rights that can help them. And I'm also very gratified to tell you we pushed out $1.2 billion in COVID supplemental funding in record time. Please know that we have championed your needs during this pandemic here in the nation's capital. From day one, we were at the table with HHS Secretary Azar, my boss, the White House, FEMA, and other HHS colleagues, including the Surgeon General and staff at CDC, CMS, and others, to make sure issues important to older adults and you were addressed. ACL staff have reached out to our stakeholders and partners through many vehicles, leaning in to make sure we addressed key issues. And most importantly, we have listened, and will continue to listen, so that we can be very strategic in our response. And I share that information with you candidly to simply reassure you that we've been working to support you and to promise you that ACL's commitment to your success remains intact at the highest level. We know many of the people that you serve are still struggling, hurting, and suffering. And while COVID has certainly knocked us back on our heels initially, I think we found our footing. And the path forward, of course, will be a bit rocky, but I'm just so grateful for the work of our network. Across the country, that aging network is forming partnerships and working together to continue to meet the most basic needs, including the need to reduce social isolation for people living in long-term care settings. At the same time, we're working on establishing a new normal, one that balances the critical need to prevent the spread of the coronavirus with the other factors that also affect health and well-being. So as I wrap up, I want to encourage you to continue your vital work, and please know the meaningful difference it makes to so many. I say that because I know that in the moment it can be overwhelming. So many people need help. And with things changing rapidly, we know that there's a lot of information to consume and often just not enough time. And remember, ACL is here to support you and we will continue to provide a range of resources to help you keep up with the important developments as easily as possible. A reminder of a couple examples of what we're doing here at ACL, quite specifically to support your elder rights and elder justice advocacy. First, we're very proud of our National Center on Law and Elder Rights, or NCLER, now in its 5th year and going strong. NCLER has interacted with over 47,000 individuals. As you know, they offer 3 core services: training, technical assistance, and case consultations. NCLER works to meet your needs by addressing the most pressing elder rights and elder justice issues of the day. If you've not yet sampled NCLER's riches of education, technical assistance, and training, I urge you to visit their website at ncler.acl.gov. That's ncler.acl.gov, and take full advantage of their services. Recordings, slides, and other materials from all NCLER webinars are available on their website, where you can also find the Elder Justice Toolkit. This toolkit provides practical tools and materials to support your work pursuing civil legal remedies in the elder justice sphere. It includes practice tips and sample pleadings for attorneys seeking redress from their clients who have experienced elder abuse. Secondly, we're also proud to support the work that our ABA Commission on Law and Aging friends have done to facilitate the Working Interdisciplinary Networks of Guardianship Stakeholders, otherwise known as WINGS. I'm sure that many of you are already familiar with the work of WINGS and really the tremendous work that they're doing in reforming guardianship. The ABA has recently produced a WINGS final report and briefing paper with information and tips for enhancing and replicating the WINGS approach to supporting adult decision-making by enhancing easily accessible alternatives to and reform of guardianship. There are many lessons from this initiative that we believe can be sustained and replicated throughout the country. Because we're stronger when we are interconnected and we live in a relational world, I'm so impressed with your continued reinforcement of critical relationships with state, local, and national partners. A few of the partners I know you keep on your radar and you're always striving to grow your relationships with include, but of course are hardly limited to, a number of partners. One, our long-term care ombudsman programs, which of course I mentioned earlier. Secondly, and I have some background in this area, the State Unit on Aging partners, which of course includes your state's legal assistance developer and your local area agencies on aging and your Aging and Disability Resource Center colleagues. And I would note that in addition to contracting with you for Older Americans Act funded legal assistance, your AAA and ADRC colleagues are such an important source of issue spotting and mutual referrals. Another great partner, of course, is Adult Protective Services. Your work with their clients who consent restores those elders' agency and sets them on a path to person-directed recovery from the abuse they've experienced. Another partner is the State Health Insurance Assistance Programs, or SHIP, and also the Senior Medicare Patrols, with whom you can do so much to assure your clients get the most out of their Medicare and are positioned to help in the fight against healthcare fraud. Also, related legal advocacy programs, some of which are co-located or co-funded, such as Legal Service Corporation grantees and Victims of Crime Act, or VOCA, funded legal assistance services and protection and advocacy offices on the disability side. Also, the assistant U.S. attorneys, who are the designated Department of Justice Elder Justice Coordinators in each of the federal district U.S. attorneys' offices, and hopefully you know those individuals. And a big shout out to the new class of Elder Justice Fellows participating in NALC this year. Most of you are hosted by the programs we fund through the Older Americans Act, and we're looking forward to working with you, and so glad you're going to be part of our family. We salute all of these partners, many of whom I know are participating in this event, and I would just say in closing that during these challenging times, I want you to know that we at ACL, again, have your collective back, and we will continue to offer you support, to listen, and to learn from you. As I hope you already know, I and our ACL Elder Rights and Elder Justice team welcome your ideas, suggestions, and thoughts on how ACL can most robustly support justice and rights for older Americans. Please know as well that our team in the Office of Elder Justice is eager to introduce you to colleagues that you may not know yet. Our team, Hillary, Omar, and Sandy, tell me repeatedly how much they enjoy their informal discussions with you. They often share your ideas with me, and these ideas are inspiring. So I encourage you to remain in touch. And I would also say, please, please take time for yourself, your loved ones, gather support from your peers, and remember that the work you do is truly important. We look forward to watching your continued growth as a coordinated and interconnected elder rights community. And with that, I think we've got a few minutes for questions. Thanks so much for your time.
Okay, now you should be able to hear me. This is Hillary. You can hear me, yes? Okay.
We can hear you, Hillary.
Well, this is an unprecedented first. I do not see any questions in the question box. So, with the limited time we have available, I'm going to pose a question to you that was mentioned to us in the run-up to this conference. Lance, when you were very first appointed, you came to NALC way back in 2017, and you presented on the goals you had for us at ACL and for America's older people. Would you like to comment on what progress you think we've made over the last 4 years at ACL?
Yeah, absolutely. Thank you, Hillary. And really, I recall that conference fondly. It was good to see all of you for the first time. And at that particular juncture, we had 4 pillars. We added a 5th. I added employment as a priority as our 5th pillar. But just quickly, for the sake of time, if you think about the 5 pillars and how truly fundamental they are to the work that we do across both aging and disability, you know, we're talking about really 5 tremendously important focus areas that remain in the bullseye of the work that we do here at ACL. You're talking about supporting families and caregivers, access to information, supporting the Aging and Disability Network, preventing abuse, and then, of course, finally, employment. So if you think about the progress we've made, pretty remarkable in each area. I would encourage you to jump on our website. We have a lot of good information about some of the programmatic initiatives we have relative to these pillars. Let me pull out one. I want to talk about just briefly supporting our network. So for us, really with the support of my boss, Secretary Azar, there's this growing convergence now of how the social service sector can help the healthcare sector in a much more remarkable way than we ever have historically. We're talking about, of course, social determinants of health and the real value of what our networks have been doing and the importance of what they do on the front end to bend that cost curve. So unlike any other time before, we now are headed into an opportunity where we're seeing the manifestation of that partnership, which really then helps support our networks. We actually at acl.gov put together a framework that is intended to really guide all of the partners within our network to better understand what we're talking about, how they can plug in. We, of course, also are meeting on a regular basis with healthcare leaders. And again, really exciting what the future holds in that regard. I point that out as one example under that pillar of some significant work we're doing. One other, real quickly, caregivers, supporting family caregivers, the backbone of how we provide services here in America. And here at ACL, we actually are standing up and leading 2 different committees, one focused on supporting caregivers, another on supporting grandparents raising grandchildren. Both of those committees have been doing tremendous work. We're getting ready to produce in the very near future reports to Congress. So again, another example of an activity within one of the pillars that just really is exciting and ought to be quite impactful. Thanks, Hillary.
Thank you. And the next question, which will unfortunately be the last because of timing, is related to what you just answered. So let me just read it here. Apparently the chat box is not working well, but I received this through my email. Lance, one of your 5 pillars for your ACL vision is to strengthen aging and disability networks, working towards our common goal of elder justice, and with our understanding that networks are made of institutions and systems. What steps has or can ACL take to understand and address systemic and institutional racism within ourselves and within the greater aging networks? That's a tough one.
Well, and of course, that's a conversation worthy of probably a deeper dive than we have time here, other than to just remind all of us that within the Old Americans Act, it's very, very clear that we're going to serve underserved populations, and that often includes minority populations, as you know, people with limited English speaking skills, those that live in rural parts of our nation, those who are low income. So really kind of a direct tie-in to making sure that we are not marginalizing anyone in our service spectrum. And I believe that absolutely remains the case. It's a priority for us. And then, of course, I think through, as one other quick example, Hillary, the work we do through the Elder Justice Coordinating Council. We here at ACL chair the 16 federal agency council, and certainly our commitment as the federal government is to make sure that we're challenging any systemic issues around this particular matter. It's just not something we're going to accept or support. And you can, again, count on, as your federal partners, to continue to be a loud voice in that conversation and to do all that we can do to assure equity and equality in everything that we are putting out there for the American public.